Nigeria in April last year had set a target of carrying out 2 million COVID-19 tests in 3 months.
The laboratory strategic group that is responding to this outbreak has set itself a target of testing 2 million people in the next 3 months.
But 9 months after, the country has barely tested a little over 1 million.
Nigeria just crossed the 1 million mark for testing across the Federation. Testing remains a key strategy of our national response.
Most Nigerians don't see the need to go get tested, except they have symptoms or have been in contact with someone who had tested positive. Some organizations have now made it compulsory for their staff to get tested.
It's because of my office where I'm working. When you step out, when you want to come back, you have to be tested.
What do you say step out?
As in, for a vacation like this now.
Oh, you traveled for Christmas?
Not that we are traveled, but I'm still around. When you are out from the company premises, so when coming back, you have to be tested.
I want to know if I'm positive or negative.
Okay, did you have any symptoms?
Not at all.
Testing for COVID-19 involves inserting a 6-inch long swab into the cavity between the nose and the mouth. The swab is then inserted into a container and sent to the lab for testing. Although irritating and uncomfortable, it is not painful. The Nigerian Center for Disease Control says it takes 24 hours for results to be released, but there are complaints that some people do not get their result on time.
The same day I came, somebody came to complain that he did the test a few weeks ago before I came, and the result did not come out. So the day I came, I explained to her that I had a contact to someone who got tested positive of COVID. I explained the situation to her, and she told me by next week I will get a message from SCDC. It's over 2 weeks, and I have to resume to the office. My office mandated me to go for the test before I resume.
This lab scientist provides some answers on the delay for days or even weeks after COVID-19 test.
After each test now, like today now, I would say the average should be 3 to 7 days. All the testing centers, not just in Abuja here, but in most of all the other states in the country, is being processed at the National Reference Lab, Gadua. So most of these delay were actually caused by backlogs.
But it's not all doom and gloom, as Nigeria's laboratory capacity has grown swiftly and tremendously within the past 9 months, from 2 at the outbreak of COVID-19 in February 2020 to over 60 laboratories in January of 2021. Well, despite the low testing capacity, which is majorly urban-based at the moment, Nigeria has demonstrated capacity in mobilizing health professionals to tackle the COVID-19 pandemic amidst a skeptical citizenry that doubts the existence of the virus. Nigeria's strategy for the management of COVID-19 has been to test, treat, trace and isolate patients. And as the nation prepares for the delivery of a vaccine in late January, health policies and infrastructures are being rejigged to make it a success despite skepticism by citizens and tough rhetoric from anti-virus campaigners. Health experts say for the country to get a clearer picture of the pandemic, the country will have to test at least 20% of its population, or 40 million people, with the results released on time to avoid infected persons spreading the virus unknowingly while awaiting their results.